All right, everyone. My name is Dr. Brian Sackey. Welcome to our Pills Conversation for tonight. So we have the pleasure of presenting to you personal stories and success from past and current clinical doctors of pharmacy as we discuss Midyear to Match, pretty much the residency process, the interview, and what it all entails. So today we do have an exceptional cast of PharmDs who have matriculated the process that you all will be going through or are going through now. And for those who are not yet in the process of residency, we hope to provide some insight as to what that all entails. Now, just a few house rules here. Everyone should be muted. However, if you do join the call or if you do get kicked out the call, feel free to call back and you will be muted. But we do ask that you mute your phone on your end just to avoid any interruptions. Secondly, our question and answer, and I already saw that there's a few people who asked how do we ask questions, and you definitely will have an opportunity to do so. First, we're going to go ahead and ask some formal questions to our panelists, and hopefully they can answer some of those questions for you. But if you do have any more questions, please follow our social media outlets. This includes Instagram and Twitter. And if you use the hashtag PillsConversation, it's PILSCONVERSATION, assuming you can spell conversations, of course. Pills Conversation, and ask a question there. We'll be happy to address it towards the end of the conversation tonight. Now, of course, this is going to be very formal/informal. We want to make sure we're keeping this very realistic and really provide some insight based on our own experiences. So feel free to ask any type of question you may have about the whole process of the residency interviews and so forth. Now I'll go ahead and pass it on to one of the officers we have on the Pills board, Dr. Joshua Blackwell, to provide some insight and some background information on what this organization is all about, and we'll go from there.
Thanks, Brian. Well, good evening, everyone. Like Brian said, my name is Josh Blackwell. I am a former resident of the Houston program and a very proud graduate of that. I am the executive chairman and one of the co-founders of the Pharmacy Initiative Leaders, so I wanted to provide some background as to what our organization is and what we provide. So our mission is that we are a nonprofit corporation which seeks to establish quality connections within the pharmacy profession and serve as a premier resource for the success of aspiring pharmacists. And so what does that look like? Our vision is to support the development of future pharmacists, particularly in those underrepresented communities. We also want to promote and increase the awareness of pharmacy in the public eye. And we want to connect with enthusiasts, which is what we're doing today. We're connecting all of you, not only to provide you the understanding, resources, and tools on how to pursue a residency program, but also after this conversation, please connect with us. We would love to hear from you, learn from you, how we can better or optimize our organization, and how we can progress in the future. And also, we want to cultivate a network of leaders with the same ideals and passion for the progression of pharmacy. So if you are interested in learning more about our organization, what ways to get involved, we would love to connect with you and collaborate with you and learn from you in the process. And so now I'm going to turn it right back over to Brian to get this Pills conversation going. Thanks, Brian.
Thank you for that, Dr. Blackwell. Now, as I mentioned, as Dr. Blackwell beautifully explained, this organization really is here for you all. We've been through this process. Some of us are actually still going through the process, and we really hope to provide you some really great information to help you along the way. So this conversation, we call it a conversation because we want it to be very organic. We want to provide very raw but truthful and realistic information as to what you may experience during this process. Now, to sort of kind of this, before we begin, I want to make sure we introduce everyone on the panel. And my apologies, I didn't exactly introduce myself formally, but I am currently operating as the CEO of the Pharmacy Initiative Leaders Pills organization. I'm happy to work with alongside wonderful officers, including Dr. Joshua Blackwell. We have actually one of the panelists, Martine Verney, who's also on the executive board. We have Dr. George Ackerman, as well as Dr. Onye Ononi, who's also on the executive board. Now, as far as myself, regarding residency, I did my first year residency at the Michael E. DeBakey Veterans Affairs in Houston, Texas, for my first year general clinical pharmacy residency. And then for PGY2, I pursued psychiatric focused specialty residency over at South Texas Veterans Affairs Medical Center in San Antonio. I'm currently working as a mental health provider at the South Texas Veterans Healthcare System. So I'll pass it on to our first panelist, Dr. Chandler Schexnayder.
Hello, everyone. My name is Chandler Schexnayder, and I'm currently a PGY1 resident at Michael E. DeBakey Veterans Affairs Medical Center, and I will be the PGY2 in ambulatory care at that medical center as well, early committed. So I'm really grateful to be on this call, and I'm really honored to talk to you all today.
Okay, and then next we have Dr. Bijan Makoba.
Hey, good evening, everyone. This is Bijan Makoba. I am a previous graduate of the University of North Carolina Medical Center residency program. I did a combined PGY1 and PGY2 in Health System Pharmacy Administration. And also got my master's from the UNC Eshelman School of Pharmacy while I was there. I look forward to our conversation.
Next, we have Dr. Martine Vernon.
Hello, everyone. I'm Martine Vernon. I graduated from the University of Cardinal Ward in San Antonio, Texas. I completed my PGY1 at the Phoenix VA, an ambulatory care-based PGY1. And then I completed my second year residency at the Denver VA in psychiatry. Looking forward to speaking to everyone and answering your questions to the best of my ability.
Thank you. And then next we have Dr. Brandon Keith.
Good evening, everyone. My name is Brandon Keith, and I graduated from the Johns Hopkins Home Care Group residency program. I completed the PGY1 community pharmacy residency and currently practicing as a clinical coordinator for solid organ transplant. And continued on from the residency program. Solid organ transplant was one of my elective rotations, and continuing on and now working with all of those patients going forward.
Thank you. And then finally, we have Dr. Rodney Hunter.
All right. Yeah, I see how it goes. Good afternoon, everyone, or good evening. Y'all make me feel old looking at these residents or these, man. I finished my fellowship in 2010, so I've been a pharmacist for 11 years now. My fellowship consisted of essentially a PGY1 year, a PGY2 year that specialized in oncology, and it finished up with essentially a year of research in oncology. I currently practice at UT Medical School's Cancer Center with Memorial Hermann in Houston, Texas, in the Texas Medical Center, and I'm a faculty member at Texas Southern University. Obviously, I specialize in oncology, so I'll be probably bringing a different perspective than some of the traditional residency programs, and as we move forward, we'll talk more about that.
Thank you very much. So as you all can see, we have a wide variety of panelists here, from VA to the private sector, various hospitals across the nation, UNC, as well as MD Anderson in the Houston area, and so forth. So hopefully we can provide you a very eclectic assortment of experiences to help you all today. Now, just want to quickly reiterate, our social media platform is what we'll be using to look for questions, and you all can go ahead and send questions there with the hashtag PILS, P-I-L-S conversation. Our Instagram and Twitter is both at PILS Connect. That's P-I-L-S Connect. Okay, so we'll go ahead and get started. Our first question will be answered by Dr. Chandler Schexnayder. And let me know if you'd rather be called Dr. Chandler, or if you want to keep it informal or not. I personally don't mind. You can call me Brian. But just for formality, I'll start it off by calling everyone a doctor, unless otherwise stated. Dr. Schexnayder. So I want to quickly ask you first, what did you look for in your residency selection? what were your considerations in selecting to go to your particular program?
Yeah, Brian, you can go ahead and call me Chandler for the rest of the conversation. I appreciate you calling me Dr. Shakespeare, though. Still getting used to it. But I will
You deserve
say,
it. You deserve it.
Thank you. But what I looked for in a residency selection was more so where I wanted to be. So I knew that at Xavier and due to my rotations, I wanted to be an ambulatory care clinical pharmacy specialist. So I looked at programs that would offer me the best training as well as to give me the most autonomous and as well as freedom in terms of being an ambulatory care pharmacist. So I looked at a lot of different VAs as well as other as well as other hospitals that had a collaborative practice agreement where pharmacists were able to have prescriptive authority. So a lot of my programs were VAs or other programs of that sort. And also I looked at geography. I'm a southern guy, so I wanted to stay somewhere it was warm, and my preferences lied in the places in the south. Also, I looked at places where I felt like I would grow the most in terms of my program, as well as the medical center, and of course in the location in itself. Some other factors that I looked at were things in terms of the residency program size of my PGY1s. I wanted the size to be 4 to 6 because I love working with other people. I wanted a residency program director that was dynamic and a pioneer in pharmacy that would mold me into a residency program director that I want to be in myself later on. Also, I looked at the preceptors and the past residents at various programs, and if I were able to identify with them and see myself in their shoes and see where they went, and based on where they went, I would see what that type of program was able to produce in terms of those exceptional clinical pharmacists. Also, some other things that I looked at were I didn't want to work every other weekend. I know that's some other things that people look at. I didn't want to necessarily be on call, and I say that because I wanted a challenging program, but also one that I would have some work-life balance as well, just so that I can carry on with my life, and as well as I don't want to talk forever, but I also want to say that all in all, that I looked at a program where not only will I be able to get a great challenge and a great experience in those 2 years, but also where I could possibly, be there for a long time, and not just have a place where I can do a residency at, but where I can possibly work and grow and develop and become a clinical pharmacy specialist.
Sounds good. Thank you. Now, of course, anyone else, if you want to provide any perspective or insight to this same question, you can go ahead and do so. I will jump in really quick just to add on to what Chandler mentioned. For me, to piggyback on what he said, really that the residency director was a huge one for me. This is someone you're going to be working with on a daily basis, essentially, and I definitely want to make sure that I had a good rapport with them, a good relationship, or at least develop a good relationship with them. They're essentially going to serve as a confidant and a director, a teacher to help you through that process. So that was a huge one for me personally, just to kind of add on to what Chandler said. Next question.
One more.
I'm sorry, go ahead.
I'm sorry, Brian. I didn't finish answering your second question. In terms of my program, things that really helped me out was getting insight from those past residents, one being Dr. Brian Sackey and others, because I was able to reach out to them before Midyear as well as during the residency process, and I wasn't able to do rotations at the program I'm at right now, so they gave me a lot of different insight, and I looked up to those people and Brian Sackey as well as Lori Gordon, who was also a professor at Xavier at the time, who went to DeBakey for residency. So those people, and when I got to the interview and I got to interact with the residents and the program director and the preceptors and just the medical center and as a whole, I felt like that program was conducive to my learning and to my growth, and I definitely made the right decision. So there you go. I'm sorry about that.
No, thank you for that. Definitely important, and I'm glad to have been able to be of assistance for you for sure. Okay, so next question I do want to ask the panelists is, or what were the exact steps you took? Now, this is open to anyone to go ahead and answer this.
Hi, I'll go ahead and answer this one. So thinking back years ago, I know when I finally decide to go back and do my residency program, what I didn't mention earlier is that I actually worked for 2 years after I graduated from pharmacy school, and then I decided to go back and do my residency. So those 2 years, I made sure that I kept in contact with people that were mentors to me that had influence in my pharmacy career. And so I had solidified my 5 letter of recommendations before I even started the application process to give them enough time to do what they needed to do. And most programs required 3 letter of recommendations, but I made sure I had 5 to 6 people on deck just in case some people couldn't meet the deadline or anything happened. I knew I still had enough letter of recommendations for my application. I also verified the requirements for each facility with not only the RPD, but also those current residents, because sometimes you can't always depend on the website to give you the up-to-date requirements. So definitely verifying the requirements and deadlines with the RPD and the residents that are there. Also did extensive research on the programs, ASHP website, the actual company website, contacting residents, current and past, reaching out to RPDs, talking to my peers that may know someone that knows someone, really utilizing my network to get those questions answered. But I would say I spent most of my time just really researching programs and what they provided before I started doing anything. Also contacting the RPD directly to see if possibly we can meet outside of Midyear or my on-site interview, because sometimes you will find that that's more beneficial for them, and so they'll be more accommodating to meeting you outside, and then it just shows you being proactive, not pushy, but being proactive. But really getting all of those things together, being very organized, because each program will require different things, and, being prepared in the process and just starting early, not starting late, because then you're more relaxed. You're not being rushed. You're not being forced. You have time to make up your mind, and you're just going through the process just more relaxed, and your mind is clear, and you know what you're doing, and you're for sure for what you're doing.
Absolutely. Anyone else have anything to add?
I do. This is Brandon. Speaking on the community pharmacy residency program side, I would say that research is probably the biggest thing that I would recommend for everybody to do, along with what a lot of the other panelists have said, because community residency programs are very different across the board. They are very different between different practice settings. So some community residencies might be in hospitals, others might be in independent pharmacies, they might be in retail or mass merchandisers, and depending upon your practice site, your patient population is going to be very different, depending upon if your practice site is in the city versus if it's in a rural or suburban community. So that all speaks to what are you going to be exposed to? Are you going to be exposed to the chronic disease states and you're focused on longitudinal care? Are you focused on more acute care? What is it that you're looking for in that program? I asked a lot of questions about where do your past residents, what are they up to now? Because I think it's very important to remember that the goal of residency is to advance yourself. We're trying to expand our clinical skills. And what is it that you want at the end of this? I know another panelist said that the goal, one of his goals was not only an opportunity to learn and grow that year, but also to continue on, maybe have an opportunity to do that. And that was one thing that I saw in a lot of the programs that I looked at. And specifically also to community programs, they are co-accredited from ASHP as well as APHA. So one of the things that you're definitely going to want to do if you are interested in those programs, you're going to want to get started early enough so that you can possibly go to APHA Annual, because a lot of people may not know that there is a community residency showcase there. You might want to go there and get your questions answered. So a lot of times you'll do research on the websites and you can find out a lot of things off of a website, but you can actually learn it a lot better when you're having conversation with the residency director and with the residents. So those are some of the things that I would recommend you do.
Awesome. Thank you for that.
Hey, this is Bajan. Just to add on to what was said, I mean, one of the major things that I did in selecting a residency was really understanding what kind of environment and what kind of experiences I wanted to gain from that residency. And I tried to meddle it down to make sure it was 3 major things. I actually looked back at my notes, and those 3 things that I wrote was, the first was a family vibe and a mentorship structure. The second was training of the preceptors and learning experiences. And then the third thing was the master's coursework. So, really in that, I was trying to figure out, in this program, what would be the difference between these programs, and how could I, take that down and write it and be able to really differentiate these programs. Because once you get there, you'll really be able to see what the differences are. It's definitely hard when you're looking at a website or you're trying to differentiate things at Midyear. But when you actually get to that on-site interview, it's pretty clear what the distinguishing factors and characteristics of each program is. So really figuring out what you want from those programs and making sure that they provide it, and you'll be able to compare programs and make some kind of relative scale to help you make your choice in the end.
Sounds good. Thank you. Anyone else have anything else to add? I know some of the things you guys are bringing up, we're going to also ask later on in the panel, but if there's anything else you want to add, you can go ahead and do that. Okay, I'll go ahead and jump to the next question. So during this whole process, of course, it can be very cumbersome. Who did you particularly speak to during, before, after to help make your decision and the particular residency that you selected?
So I'll go ahead on this one. This is Chandler. So for me, I was in the PILS coach program. So I had a mentor that helped me throughout the residency process. So even from September, so working on my CV, getting deadlines in for that, as well as letter of intent, doing mock interviews, et cetera, the works. And you can look up the PILS coach program. I'm sure Brian can tell you more about that. But Brian and also my mentor from Xavier were 2 people that I talked to a lot during and before my interviews. And but after my interviews, to help me make a decision, I actually talked to my family and my fiance in terms of, this is a place where I would want to go. This is a place where I feel like we can grow in terms of not thinking about just, like I said before, those 1 or 2 years, but where we can go in the future. But I do recommend, if you are a P3, P2, or P1, definitely look into the PILS coach program. It definitely helped me out tremendously and gives you someone to talk to who's also been through that process and can give you successes and failures that they went through as well.
Thanks for that, Chandler. Yeah, as Chandler mentioned, the PILS coach program was really a new one for us, and Chandler is an awesome candidate himself, but that process was one that certainly, at least we tried to help with that decision-making process, as well as sort of the helping make you an even better candidate. I'm glad that was very helpful for him. And as far as sort of this the decision-making process, again, it could be much more cumbersome than we think, and kind of talking to a lot of different people is going to be very important because it is, of course, an important decision, but it does play a role in sort of what you do later on in your future with your career. Does anyone else have anything else to add to this? Okay. And we will talk a little bit later on about sort of that decision-making process as well, so we can provide some more insight there. Now, as far as the on-site interviews, some people may do PPS during Midyear, but there may be some disparities there. So I want to ask our panelists, what are some of the differences that you notice between an on-site interview and the PPS interview based on your own perspective? And I know, for example, Dr. McCullough had, he did an administration residency, and I know for that particular residency there is a lot of PPS interviewing as well as on-site interviewing. So I want to know if you actually experienced that difference, and if you want to provide some insight on that as well.
Yeah, sure. So as Brian mentioned, interviewed and I completed a pharmacy administration residency. And I will say there's a large difference between the type of vibe that you'll get when you're at PPS and what you'll get at an on-site interview. At PPS, it's more of a information dump, so really all the programs are focused on is providing you with information about their program. That's really it. They'll give you their information package, their website. They want to make sure that you have all the information you need so that you can put in that application and apply to their program. But when you get to the on-site interview, it gets to a lot more deeper level because they really want to know, what it is about you that makes you a fit for their program, and then vice versa. So when you're at the on-site interview, it varies depending on, I guess the program's character, because some are a little more intense than others. There are some on-site interviews that are laid back. But what I will say is that for the pharmacy administration rotations, these things were all day. It was 8 a.m. to 5 p.m., and it was back-to-back interviews for a lot of them. So there is some, physical and mental toughness you'll have to have going to it. But one thing I will say is that you'll realize that these programs have their identity set. You'll learn what rotations they have available, who the preceptors are. You'll learn about the patient demographics at the hospital. But what's equally important is understanding your professional identity and knowing what skill set and knowledge you want to take from the program and what you want to portray during that interview day so that you stand out and you're remembered during that process.
Sounds good. Thank you. Does anyone else have anything else to add to that?
Okay. I would say for me, this is Chandler. I did PPS last year as well as on-site interviews, and I do agree that it is more so an information dump, and I think for me it was less stressful, the PPS interviews. But I will say that if you are any P3s and lower on that, thinking about doing PPS and are interested in residency, I think it was good for me because it not only did it give me an insight on what an interview may be like, but it also helped me practice in terms of presenting myself and doing in an actual interview session. So I definitely recommend it, and I think that like I said before, it is a little less stressful. But if you prepare for it like as an actual interview, you will get some benefit from it, and you may have a program on that you really enjoy.
Thank you. All right, so I'll go ahead and move on to the next question. And if my memory serves me correct, around this time is where everyone should start receiving their interviews, and it's very stressful from what I remember. Just checking your email every day, hoping to get that letter or that email that says, "Hey, welcome aboard," or "Sorry, we regret to inform you." So this particular time period is very stressful. However, it's never too early to start preparing for those interviews. One of the major parts of an interview process is typically a presentation. So you don't really know that until you get that email that says we will require you to do a presentation. So I do want to ask the panelists, what particular, if you had a presentation, I'm assuming you did, what was your presentation on and why? And Chandler, you can go ahead and start because I know you're probably more so had a recent process with this with you in your current PGY1. Yes, I'll go ahead. So my presentation, and it depends on what type of residency you're doing, but for the most part, if you're doing general PGY1, you'll be asked to do a clinical presentation. And for me, the one I chose was on benign prostatic hyperplasia. And the reason why I chose that is because I believe it was one of the presentations that I excelled really well on during my rotations as a P4 student in the fall. It was when I did at Bourne-Jewish Hospital that was, I edited a lot, and I got a lot of feedback on. And also I knew that I was going into a lot of different VAs or just in hospitals in general where BPH is very relevant, and I can relate it. I can maybe apply it to that to the various medical centers I was at. So I just chose something that I did previously and that I felt comfortable with, and just so I can be able to present myself in the best way possible. Thank you. Anyone else have anything to add?
Well, yeah, this is Bajan. So similar to what Chandler did, I chose something that was from a rotation and a topic that I was very comfortable in. I believe the title, I did a case presentation on pelvic inflammatory disease with an overview of chlamydia and gonorrhea. And I chose that really because I found it to be interesting. In my mind, it was simple. It might be something that could be complicated for others, but for me, it's something that I could easily remember. And if anyone asks me questions, I could definitely go back and forth as needed. So I would implore you all to do the same thing. I mean, if you're going for a general PGY1, you should definitely pick a topic that you're comfortable with and that you can answer questions, whether it's something that's related to that topic or something that's adjacent to the topic. You just make sure that you're comfortable with what you're presenting and you've done it before in front of a crowd, especially a crowd of PharmDs as well as students, so you get that variety of questions from depth to, that superficial layer.
Yes, very, very important. Thank you for that, Bijan. One quick thing I do want to add about presentations is that a lot of times programs are asking you to present not just based on the content, but just your presentation skills and sort of your ability to relay information that you've gathered and presented to an audience, which may be your contemporaries or other fellow providers as well. So it's really a combination of things that they're assessing with that. So moving on, next question, more so discussing for the panelists, what were you doing to prepare exactly a week to 2 weeks before your on-site interview? And Martin, I know you did PGY1 and PGY2. You probably have experience from two different perspectives. I don't know if you want to start or I actually heard someone else.
I'll go ahead and start. That's fine. I would, for first week to 2 weeks before, I didn't want to stress myself and go over my presentation over and over and over and over again because I felt like personally that stresses me out. It doesn't make me get more comfortable. It further stresses me out, and then I make changes in my presentation. So instead of doing that, I made sure logistically I had everything set. I had all of my time verified. I had all my reservations done, my transportations done. I made sure I had all my material. I covered my CV, did practice questions, did mock interviews, thought about things that I still wanted answered about the program. But I didn't really focus too much on the presentation versus what I wanted to get out of the interview, because although you are selling yourself for the interview to get that residency, you also want to make sure that it's the program for you and I'm getting all of my questions answered. So just making sure there wasn't any unanswered questions that I had about the program, and if there were, I had those questions down to make sure that when I left that facility, all of those questions were answered. So definitely just making a checklist of what else I needed to do, make sure everything is together and organized, and make sure I'm as prepared as I needed to be for the actual interview.
Yeah, absolutely. And someone else was going to speak before that?
Sure, yes. This is Brandon. Thanks, Brian. I would say for me, I agree with everything that was said, making sure that your CVs are prepared, making sure that your travel accommodations are taken care of. But at the end of the day, when I think about what I prepared for days before, the week before, it was really thinking through my responses to those questions that you always get asked. Why our program? What are your goals? And do I really feel passionate about this residency program? What am I going to say to those questions? What makes this program unique, and how is this going to help me get to my goal after residency? And making sure that there's sincerity in what I'm saying. I think that's, and I'm probably jumping ahead to another question, but I think a lot of what the interview to me is making sure that you are a right fit and making sure that you are passionate about that program. And I don't know necessarily that you can prepare for that. I think a residency director a lot of times is going to be able to sense that. I feel like a lot of that is trying to feel out your vibe in that interview. From a resume standpoint, they've already reviewed it. The committee has looked at it. They have most likely vetted you from a certain point. Now they want to see, can you speak what's off of your resume, and can you, do they feel like you are truly sincere and this is the career and this is the program that you want? So I think that was a lot of what I focused on, the nights before my residency, is just thinking like, what am I interested about this program? And And as the other panelists have talked about, making sure that I had my questions so I could mark off the loose ends that I wanted to know about the program.
Thank you for that. Definitely important.
This is Rodney. I guess I'm off mute. I guess all of us are off mute now. So as far as like preparation for the interview, I remember at MD Anderson when I did go to that interview, there's something distinct that I did, and I think it's what separated me. And you may not be able to do it with all of the residency programs because it depends on how organized they are as far as the itinerary and when they send it out. If they send it out early enough to where you can see individually who you're meeting with, I actually knew something about every single person that I met with at MD Anderson that day. So every time I went to a new person I was going to speak with in the interview, I actually might be able to bring up like a research project they were working on or a subspecialty that they work on, maybe ask them a question specifically about what they work with. And they probably didn't pick up on it until the end, but it definitely made it to where the conversation piece where they were really getting to know me was more, it was easier to kind of transition into things when I was talking to them because I actually had something to talk to them about as opposed to just being like an extremely dry conversation that's generic like it is with all the other 50 to 70 residents that they're going to interview. So if you can obtain information about the people that you're actually interviewing, that are interviewing you, essentially like they know a lot about you, but maybe learn some things about them, it makes it it increases the comfort level of you as the person being interviewed when you can talk to them about things that are directly related to what they do.
Definitely important. Thank you for that.
Oh,
sorry.
I want to quickly piggyback off what Rodney just said. I think that's really important if you can possibly research the people who may be interviewing you. But you can also for sure do that for each residency program director because you know you're going to be talking to that person. And that's something that I did as well, like maybe just researching some of the publications they did, et cetera. So definitely want to reiterate that.
Yeah, absolutely. Sure. Anyone else have anything else to add? Okay. So we have an exceptional cast of PharmDs here, so I'm sure everyone had multiple on-site interviews. The big question here is, how did you prepare for each one? Now, I want to start with Chandler. Again, I work with him, so I definitely recall how many he had. It was quite a few. And so how particularly did you prepare for each one?
So for me, I made sure that for each one that I knew like my CV more than I knew everything else because I knew that anything on my CV was fair game, and I wanted to know myself because you know as a student you've done great things, you've done impactful things. You want to be able to present that for each residency program that asks you, but specifically for each one. If I didn't have a presentation for one program, then I was able to the week before or the night before, whatever it may be, I was able to write down all of my questions that I had specifically for the preceptors. I wrote down questions that I had specifically for the residency program director, as well as questions specifically for the residents, because I knew there were going to be different type of sessions where I was able to talk to each of those people. I will review each of the residency programs website, making sure I didn't miss anything. Also, I wanted to make sure that I wasn't, because I had so many different on-site interviews, I didn't want to stress myself out, like another panelist said, stress myself out and actually take some time to breathe and relax and be able to not go over things too much per se. But I think the biggest thing for me was to write down those questions and know exactly what I want to ask, as well as because you have multiple on-site interviews, each interview you're gonna get better basically in terms of being able to answer those hard and easy questions. I made sure that I knew exactly like the simple question of tell me about yourself. Made sure I knew that down pat because I want to know more about myself, knowing your strengths, knowing your weaknesses, how you're mastering your strengths, and how you're bettering your weaknesses. And also just getting a list of questions that you can be possibly asked. And I think that over time you get a lot of mock interviews, you do a lot of practice, and over time, as you're going through those multiple on-site interviews, you're going to get better. But I think that for each one, you want to make sure you write specific questions because that shows your interest, and you want to know if you're a great fit for that program. So you want to make sure that the questions are being answered and they are to what you want in the program.
Thank you. Definitely important. Anyone else? Now, I want to add one quick thing. When you have a lot of multiple on-site interviews, just be sure to not accidentally respond to the wrong person. Make sure you're very careful in your response in accepting these interviews. You don't say the wrong name, wrong director's name, wrong site name. So just be very, very careful with that.
So, Brian, we do have a question from the audience, and it's a great question from Joe. This goes to, I think all panelists should be able to answer this question, but just in case you didn't land a residency, did you have a backup plan? And what was that backup plan?
Great question, Joe. Does anyone want to go ahead and take that?
I can comment on that. So backup plan if I didn't land a residency. So the first year I applied for a residency, I did not land a residency. So my backup plan was to try again. And when I tried again, I landed a residency. So I knew it was something I wanted to do. The first time, it wasn't the right thing for me. I didn't prepare for it. I rushed into it. It was something that I wanted to do prepared the last minute. And I just wasn't prepared. I didn't have everything in order. My priorities were not in line as I wanted them to be. So going around the next time, I knew what I needed to do differently. I knew I needed to organize better. I knew I needed to connect to people better. I knew I needed to utilize those 2 years to really build a name for myself and work hard in the field that I was working in and to make my network even stronger. So that when I applied again the next year, I was able to get the residency programs that I wanted to get. So if your goal is to get a residency, you just have to learn from your mistakes and try again. And if it's meant for you to get a residency, you will get a residency.
Definitely important. Thank you for that, Martine. Me personally, so there was when I did the residency process, we didn't have phase 2. But I'm one of those super over-prepared. I just prepare for anything. And I had a scramble package where pretty much if I didn't match, just have all the information ready. And if I remember correctly, the scramble is slightly different from phase 2 in the sense that you're essentially, it's less formal. You're sending information and letters of intent, CVs to individual residency programs that didn't match. So I sort of had all that prepared in the day when the day comes where I didn't match and ready to send that off. You don't want to be scrambling to put that together and sending that off, especially there's a brief time period between that. But at least with the phase 1 and phase 2 process, that helps to reduce some of the stress that's associated with it, and then you still end up having a scramble. So a scramble package is important.
So we do have another question from the audience, and I'm going to direct this to Rodney. Considering that you've been in a plethora of residency interviews or interviews in general, what are your thoughts about applying or interviewing with non-ASHP accredited residencies? And that question came from Tio, so thank you for that question.
All right. So as far as that was actually something I was going to bring up, I guess, like when we maybe got to a different part of it, but I can go ahead and talk about it now. Basically, with ASHP accredited residencies, that's the gold standard at this point. I think, of course, I graduated in 2007, so it was a bit different climate as far as what was accredited and what was not accredited, and if it was a good program. A lot of the PGY2s, when I graduated from pharmacy school, were actually probably 50% of them weren't accredited, 10 years ago, 10 or 11 years ago. But at this point, most places are accredited or they're about to obtain their accreditation and are working towards it. However, like fellowship programs, academic fellowship programs, like the program that I completed at MD Anderson, is not accredited by ASHP. It's peer reviewed by ACCP. So another entity, the American College of Clinical Pharmacy. So there are a couple of different types of programs. I think, of course, ASHP is the largest of all of the pharmacy, training, postgraduate training like entities, but there are others that, a lot of people look at those avenues, especially if you are really interested in academia. So I guess to answer the individual's question, it depends on what is your end goal as far as your career is concerned, on if you have to do an ASHP accredited residency. Because if you were looking into academia, then there are not as many programs, of course. There's probably less than 100 of them, but they're all scattered across the country that are peer reviewed by ACCP, and they're fellowship programs that have a clinical component and a research component to them, and they're typically at large academic institutions, and usually the biggest ones in the country, because they have a lot of they dedicate a lot of money to you, because you don't staff in most of those programs, so you're not bringing anything to the table from a staffing standpoint. So they have to fully fund your position with either research dollars or directly from the institution. So that's how I would answer that question. Depends on your career end game as far if you have to do an ASHP accredited residency.
Thank you very much for that. That was definitely in depth. And as you all know, Dr. Hunter has a breadth of experience in various environments, both non-ASHP and ASHP accredited environments. So that was very, very helpful. I learned a lot myself, actually, with that. I want to ask the panelists, with the on-site interviews, a lot of people do get nervous about this. Some of the questions that I remember hearing that I maybe asked as they came on site were pretty interesting. So just want to ask, what were some of the questions that took you by surprise? Brandon, if you want to go ahead and start. I know you did a community residency currently at Johns Hopkins, so wanted to know if there's anything interesting there, and if we can go ahead and open up to anyone else.
Sure. Thank you, Brian. I'm trying to think back to that day. What questions did people ask that took me by surprise? I think, to be honest with you, I think all the questions that I received was pretty straightforward. Some questions that are kind of unconventional, although I think most people ask are, what do you do for fun? So having prepared questions for that's outside of your asking for your clinical skills. But I actually did want to, I'm glad you called on me, because I did want to jump back to Joe's question just for a second, because I think that is a very good question, Joe, that you asked about the backup plan, and I wanted to really share this with the group because I feel like it's important. I think us knowing that the residency match is in March, for you not to have a secure backup plan, for you to either have some sort of opportunity where you have your foot in the door or something secure, I feel like you really need to have that, before waiting on the match results. Because I do know, I do have a lot of colleagues who I know went through that process, and maybe they did not receive a match, and they, and they went through the scramble. But after the scramble, if they did not match, they were at a disadvantage, because a lot of your peers you have to think about, they've already snatched up all of those jobs and fellowships that now you are trying to get in March and April. So you really have to think about your best interests. I know that may not be the most politically correct answer, but you really do need to think about what are you going to do when those loans are due, and you obviously need some income, and you definitely want to make a plan ahead of time for that before you get your match results. So really think about what that means for you. I guess for some of our fourth years that are getting ready to go on their on-site interviews, as well as even for our younger pharmacy school students, it's something you definitely want to think about. Make sure you have something secured.
Very important. Thank you. Thank you for that.
Yeah, I would definitely. I like that. I like that concept, and I echo that sentiment that I had a job that was lined up, as well as I had some other avenues that I was going to take if I didn't receive the fellowship. Not that I was giving up on it, but that I was kind of buying myself another year. And being a faculty member, and of course mentoring a lot of students over the years, I've frequently told my students that are pursuing residencies and fellowships to make sure they have a backup plan that generates revenue after they just in their back pocket, just in case they need it, because you definitely want to have a contingency plan. And maybe a contingency plan for some people can be, I want to just apply for residency next year, and financially they can handle that type of burden for a year. But, I mean, I already had a child and a wife at that point in time. So if I didn't get that fellowship, I definitely had to have a job that was lined up. So definitely get as many jobs or as many opportunities as possible, and then professionally decline them once you get to the point where maybe you don't need them.
Yes, absolutely. Thank you.
So we do have questions from the audience. So one of those is from Steve from Pittsburgh, and he's asking, for programs who invite residents for dinner, will attending the dinner give you an edge over not attending dinner?
I can go ahead and just address that or try to answer that really quickly. Just to put in perspective or just to give a little bit of insight on dinners, dinners were pretty interesting for me. A lot of times when you get dinners, it ends up being a 2-night event where you come for the night before, have the dinner, and then the next day is the actual interview. For me, whenever I had a dinner, and sometimes it ends up being lunch, but whenever I had a dinner, I believe, and I learned this later on, especially after I was on the other side, they're really trying to assess your ability just your social ability, your ability to connect and interact with some of your future peers. And seeing you in that environment is a little bit different, and it can make a lot of people uncomfortable. But for me, I just try to be myself as much as possible, and I think that was the most important thing that I could do in that setting. But don't starve yourself. It's probably one of the biggest advice I can give you. I remember when I was on the other side of the table when I was interviewing candidates, there was a candidate who literally starved themselves, and you can hear their stomach growling throughout the whole dinner. So again, it goes to the whole fact that you do not be yourself. Be yourself. The dinner it should be in a way for you to interact and get to know the program a little bit better.
So another question from one of our audience members. I'm going to combine Janice and Ruth. Did you actually seek employment as a backup plan, or did you just get an offer? And for those of you who may have had maybe an internship already established or a job already established, how did you convey that there's a possibility you may break the contract because you were pursuing a residency? So how did you manage that message?
So I can respond to that question, should Janet and Ruth. Very excellent questions. I actually did have an offer that I had accepted, and I had to quickly follow up with that organization and let them know that, this opportunity had come up, and this is something that I've given a lot of thought, really appreciate the opportunity, the potential opportunity, and maybe at some point in the future our paths may cross again. But that conversation where I said that I was not going to continue on with this offer that I had accepted, that was a phone conversation. I had been in contact with the organization's leadership, so I did know the appropriate individual to reach out to. So I let that individual know that, I had received another opportunity, and I decided that's where I was going to go with that. And I think as long as you do it as direct and professional as you can minimize the damage. For some organizations, that can end up getting you crossed off. But if residency is what you really want and you've really thought about your personal goals and you have that opportunity, then sometimes you do have to disappoint people. But as long as you do it as professionally as possible, then I think you're doing the right thing for you.
Thank you for that. Josh, do we have any more questions?
We do. And this is from Poonam. She has asked that as you were going through your interviews, what was the one thing you may have wished you could have taken back or that you learned from in order to prepare for the next interview? That may be a tough question, but I know I have an answer because there's always something that you can improve on in an interview. So if there's anything that you think you could have improved on an interview or you wish you would have known or done, what's that one thing so that way that everyone on the call can learn from and then not do or maybe rethink about?
I have one. So this also ties in with like some of the tough questions you may be asked on interviews. So I think maybe early on in my interview process, I was asked a really tough question. For me, it was they asked me, in an event that you missed a deadline, what did you do? And in that interview, just to be honest, in that time in pharmacy school, I didn't miss any deadlines. And at the time, I didn't know it was okay to tell them that, like, I haven't missed a deadline, but this is what I would do if I did miss a deadline and how I would improve upon that. But in that interview, the first time I heard that question, I kind of made something up, and I didn't really feel comfortable with my answer, and it may have showed, I'm not sure. And then going to my future interviews, it's something that I learned that it is okay to, if you're asked a question, you don't necessarily have to make something up. You can answer honestly, and just being able to still answer the question, even if you haven't experienced that, and saying what you would do in order to improve upon that situation, how you did better, and how would you correct it if it did happen.
Yes, I 100% agree with that, for sure. If you don't know, if you don't have an example, you can simply state that.
Absolutely. Steve has another question. I think it's a great question, and I'm interested to hear what the panel has to say. But in the event you receive a clinical question, which you may not know the answer to, what is the best course of action in that moment?
I do not know, but I will get back to you.
That's what you say, FYI. They're just joking. Go ahead.
Me personally, when I came across a clinical question like that, and sometimes actually I had an interesting format where there was a case, then I had to, they went around the table and asked me the question, or asked me questions pertaining to the case, and I had to answer it, which can get interesting because if you had a completely different answer or you solved the case in a different way, you may be completely thrown off by the questions they're asking you to prompt you for that answer. But always know that it's okay to ask for further clarification, some supporting data, some more information to help you answer some of these questions. I think sometimes we get stuck with the answer to that question. You have to answer it directly there. Asking for more information can further clarify. You'll find that, oh, okay, this is what you were referring to. Now, of course, you're not going to know the answer to everything. You do have to be very transparent. There's actually, I received some information from some of my mentors, some advice that if you really don't know the answer to a question and say, I'll get back to you, you should definitely get back to them. I had, when I sat on the board for PGY2, actually, I had a candidate who didn't know the answer to a question that I asked them during their interview or their case, and they sent me the information back with supporting evidence and article references within 24 hours, which was pretty impressive. So if you do actually, in an event you don't know the answer, do not confabulate and make something up. It is okay to say I'll get back to you, but make sure you follow through with that.
I would piggyback off of that as far as getting back to them with extremely, maybe detail-oriented, evidence-based answer is like it really reflects positively on you, even if you didn't know the question initially. And I'm more or less the person asking the question these days and not getting asked the questions. But when I do ask residents, potential residents, students, interns questions, I do like to see that at least, like let's say if I ask you a very pointed question, you may know information that is around that particular subject. So if you start talking through things and you start telling me about correct information that is related to the topic but maybe doesn't exactly answer the topic, without rambling, of course, it kind of shows me that your thought process is in the right place, but at the same time you're just not there where you can exactly answer my question, because as you say, like nobody knows everything or nobody can answer every question. However, if it gets to be where you getting back to too many people during the process of being asked questions, then it kind of appears that you essentially don't know anything but in all actuality, maybe you don't have the answer to their question, but you're very close to it. You just need a little bit more information to definitively answer it, if that makes sense.
Yeah, definitely. Thank you for that. Yeah, that's definitely important for that. Josh, is there any more questions or?
Yes. So Ms. Jessica asked, if you don't mind sharing, could you please share something you felt made your application strong or unique, or even within an interview, what made your interview time with the program that you were interviewing with strong or unique?
I can answer that question, Jessica. Applying for residency second time around, what made my application strong and unique is how I fulfilled those 2 years. So during those 2 years, I took on challenges at my job, and not only succeeded at those challenges, but actually went on and super succeeded those challenges and went on to district management at my retail. I went into management during retail. I took over a troubled store and made it into a green store that succeeded in the community. I went above and beyond the other community pharmacists in the area and with the company. Did a lot of volunteer work. Really made a name for myself in the field at Target, where I was doing my retail pharmacy for 2 years, with the mindset of applying for a residency in 2 years. So going into my residency application, I had the experience on my application as opposed to a student just graduating and applying for residency. I came in with job experience. I came in more mature. I came in more responsible. And I came in showing that I could manage the challenges that would be thrown to me during residency, and I would be able to succeed at it. So that's definitely what made my application more unique the second time around.
I just want to answer really quickly. I think that's something that made my application really unique was my out-of-network rotations that I did my P4 year. So I was able to go to Haiti on a mission trip that was part of my global health ambulatory care practice rotation. So I was able to speak about my experiences with that on my CV as well as in my interviews, as well as going to Barnes Jewish Hospital as well as Eli Lilly. And I think that doing those 3 out-of-network rotations, doing my P4 year showed that I was willing to accept challenges and throw myself into unfamiliar situations, in which residency is an unfamiliar situation, and that shows that you are definitely able to acknowledge that you have to go through obstacles to grow and go through different experiences. So I think that's something that really helped me out in my year.
Sounds good. Thank you for that. Now, I just want to quickly mention we've had a great conversation so far, but we are at our time. And so I just want to quickly check in with the panelists if they're okay to answer a few more questions for the next 5 to 10 minutes, if that's okay with everyone. I know we have a few more questions also from our audience as well, but just want to get that clarified with the panelists if that's okay.
Yeah, I'm fine with that.
That's fine.
Yeah, definitely.
Okay, sounds good. And just to mention, for those on the call, feel free to ask any questions. We can always answer it later on through our social media at Pills Connect, both Instagram and Twitter. And you can always reach out to any one of the panelists via LinkedIn. Some of us are actually ambassadors, Dr. John Makova as well as Dr. Chandler will be an ambassador as well, actually, so you can reach out to them on our Pills website. But we'll go ahead and continue with the questions. Josh, want to ask the next question?
Yes. So Joe asked another great question. So, and this is very futuristic, actually. So what should one do if you pursued a residency, which you all have, you obtained and completed it, but now you're on the other end and you cannot find a clinical job that requires residency training? So what do you do for those individuals that graduate from residencies, but it's very difficult to find a job?
Hey, this is Bajan. So speaking on the management side, if that was to be the case, if you're looking for a job, you do have residency training, but there's nothing out there that you can find. What I'd recommend is finding a job that, taking a job that doesn't require residency training, so whether that be a staff pharmacist position at a hospital or something similar. But, take that initial job, but while you're interviewing, make sure to mention that you have ambitions to work in a clinical position so that your employer knows or is inspired to create a position that will meet your needs or, make it more fulfilling for you. Because one thing that's really important to know is that because you do or will have residency training, that is something that differentiates you from the general pool of pharmacists. And that's something that people typically look for and want to keep within their staff. You typically want to have more PGY1 and PGY2 trained individuals within your clinical staff. So it is important if you feel like if there's a scenario where you don't have any jobs or there's no job that you can get, definitely mention that to whoever you're employed by. And even if your first position isn't the ideal position, maybe in a few months to a year, your ideal position may pop up or may be created internally.
Thank you.
So we have another question from Jakar Min. He has asked that would you all recommend the STAR method when interviewing, and how careful should you be when answering questions regarding your weaknesses? So for those on the call who may not be familiar with the STAR method it is a type of interview method that a lot of employers typically use, and STAR stands for situation, task, action, and result. So anyone can answer that. Maybe even Bajan, since that is a very much a managerial thing to do. Anybody on the floor?
This is Bajan again. I would recommend be truthful. Be careful. Like if you would say your weakness is something that would be a detriment to you being in the position that you're interviewing for, then I would, be careful saying something like that. But, if it's a general weakness, we all have them. Even the person who's interviewing you has a weakness. So be honest. That's what people typically look for, especially if your weakness is something that can be trained. If it's a competency thing that they can provide you with more education or provide you with mentorship to grow, then, people don't typically look at that as a bad thing. When I'm interviewing people or when others are interviewing people, they really look for that personality and look for fit. So as long as you have that, training competency or some other weakness is something that can always be worked on. We're all improving. So try to be truthful and try to be very concise in your answer.
Okay, another question. As a P4 student, how do you balance rotations, searching and applying for residencies, interviews, and prepping for mid-year?
I'll answer this question since I just graduated actually. So as a P4, it is difficult balancing all those things because you're trying to do your best on your rotations and get those great experiences as well as recommendations for residency. But I think it's really important to have a plan and to be organized and have a schedule of what you're going to do. So you're going to work on your CV and maybe turn it to your mentor at this time. You're going to work on your letter of intent. Of course, giving your all at your rotations every day because it's really important for you to get the most out of the rotation. But it's tough, but you have to have that mentality that going into mid-year and going into residency that it's something you really want to do, and maybe having to sacrifice a little bit of your free time to research those programs and to work on your CV and letter of intent outside of those rotation hours, and also being able to be organized in your approach in terms of for mid-year or if you do PPS and whenever you research programs, making sure you have maybe a chart or a document that has that information readily available for those programs. But to say it's easy is not. but it's a challenge, and it's something that will help you going forward, because residency is also a challenge. And if you can get through that P4 year, then hopefully you'll be better suited to get through residency as well. But I definitely think that you have to be organized in your approach.
I certainly agree. Thank you for that, Chandler. So now we're at the end, the conclusion of our webinar session. Hopefully this is very insightful. I want to open it up quickly to the panelists if there's any last-minute advice you want to provide our audience today.
Yes, a couple of things. Really quickly, back to preparing for each rotation, I will say that something that I learned last year was to please get a lot of sleep, get an adequate amount of sleep before your interviews, and get to the interview at least 30 minutes early, an hour early. Just being on time, being well rested, being energized, eating breakfast, eating during the interview. It's just, you really want to be prepared in that sense, because you don't want to be lackadaisical or just lethargic throughout your interview. And also, something that really helped me last year was that you're going to have a couple of different interviews, and you're going to perform at varying levels of those interviews. But I will say that don't choose your number one program based on how you did on a particular interview. Choose your number one program based on what program you feel like you fit best with, and you feel like will coincide with your goals, because it's about what you prefer, and that's necessarily how you did on the interview and what they prefer. So really choose the program that's best suited for you, and don't rely on other factors. And thank you for the opportunity. I really appreciate it.
Absolutely. Thank you. Thank you for all of that. That was awesome. Anyone else?
I just say, like, I mean, you probably don't have this problem like frequently, but if you do have this problem, it's definitely something that I would have done differently had I been able to do it again. And that's if you are extended like a position in any type of way, or you're in a position because, of course, like there's a match, but sometimes you kind of know more information than what the match is going to give you in so many words. So in the event that maybe that program that highly covets you, if that's not your number one choice, and you don't know how to tell them all of those types of things, I would just say, because pharmacy is such a small entity it is, like, I would tell you to professionally, like, kind of come to that program and essentially let them know kind of what your plans are moving forward. Like, the match is going to come out, and, you're going to have matched with this program, that program, but there may be a program that's highly recruiting you. It's just good karma to make sure that you reach out to that program that was very much on you, if you will. Talk to them, kind of let them know, what your goals were. Maybe not just tell them the exact reasons why you didn't choose their program, but maybe make it very clear that you appreciated the interest, you appreciated the opportunity. And a lot of that stuff comes back to you in your career. I have people that I work with now that were my mentors, and now we're peers. And I think if I maybe ended things differently when we separated ways, maybe like my career isn't the same way it is now. Maybe it's not as successful.
Very important, yes. And Martine, I believe you were going to say something.
I was going to say something very similar, just to piggyback on that. It's just keep your networks strong throughout the process, before your residency, during your residency, and after your residency, especially when it comes for looking for that job after the residency program. You want to make sure you have a good relationship with your preceptors, with your rotations, your RPDs, the nurses, anyone you come in contact with. You want to make sure you leave a good taste in their mouth for your character, because when it comes time to look for a job, the pharmacy community is small, healthcare is small, everyone speaks to each other. So you just want to make sure you keep your relationship strong, you hold yourself to a higher caliber than other people, because people are always going to be talking about you, whether you think they are or they're not. You always want them to say something positive about you, so when it comes time to getting that job, they know who you are.
Yes, absolutely. Definitely important. Anyone else have anything else to add? Okay. So I do just want to mention it again. Though this process can be very stressful, just relax. It's not the end of the world. Be yourself. You are a unique individual. Your uniqueness does service your benefit. So certainly be yourself throughout this process. Hopefully this advice definitely helped you. And I'm going to hope that everyone's going to be successful in their endeavors. But if you aren't successful in your pursuit of a residency, just know it's not the end of the world. There's so many options out there, and you can always, again, have the opportunity to go through the process again. So I wish everyone the best of luck. And, again, feel free to reach out to us either via our social media platforms, or you can email us directly at PILSConnect, PILS, connect@gmail.com. So I want to personally thank everyone on the call and definitely thank the panelists for taking their time out of their busy day to provide very resourceful information. I learned a lot actually myself, and I hope that everyone else did. Thank you. So this concludes our call. Everyone, have a good evening.